Psoriasis is one of those skin diseases that not only affects the body but deeply impacts the mind as well. It's not just a rash or dry skin problem, it's a chronic autoimmune condition that changes the way your skin cells grow and renew. In this detailed awareness video, we will explore what psoriasis is, why it happens, what triggers it, and how it can be managed through both medical and natural ways. Psoriasis happens when the immune system starts working in overdrive. Normally, skin cells take about 28 to 30 days to form, mature, and shed. But in psoriasis, this process speeds up. Skin cells rise to the surface within just 3 to 5 days. Because the body can't shed them fast enough, they build up, forming thick, scaly patches. These patches are often red, inflamed, dry, and itchy. The most common areas where psoriasis appears are the scalp, elbows, knees, lower back, and sometimes even the nails. But in severe cases, it can affect the whole body. The condition is not contagious. You cannot catch psoriasis from someone else, but it is deeply misunderstood by society, and that makes patients suffer emotionally as well. The exact cause of psoriasis isn't fully known, but doctors and researchers agree it's linked to an overactive immune system. The immune system mistakenly attacks healthy skin cells, thinking they're harmful, and that triggers inflammation. This autoimmune response causes redness, scaling, and itchiness. Genetics also play a big role. If one parent has psoriasis, the child's risk increases. If both parents have it, the risk becomes much higher. However, genes alone aren't enough. There must also be environmental or emotional triggers. Let's talk about those triggers. Common triggers include stress, cold weather, infections like strep throat, smoking, alcohol, skin injuries, and even certain medications such as beta blockers or steroids. For some people, even mild stress or lack of sleep can bring on a flare-up. There are several types of psoriasis, and each type looks a little different. The most common one is plaque psoriasis, which causes thick, scaly patches on the skin. Guttate psoriasis often affects children or young adults and appears as small, red drop-shaped spots. Inverse psoriasis occurs in skin folds like under the arms or around the groin, where it can be shiny and smooth rather than scaly. Pustular psoriasis has white pus-filled blisters, and erythrodermic psoriasis is a severe, full-body form that requires immediate medical attention. The symptoms of psoriasis vary. Some people have mild patches that come and go, while others struggle with constant flare-ups. Common symptoms include dry, cracked skin that may bleed, burning or itching sensations, thickened nails, and stiffness in joints. In some people, psoriasis also causes arthritis known as psoriatic arthritis which leads to joint pain and swelling. Psoriasis doesn't just affect the skin, it affects confidence, mood, and relationships. Many patients isolate themselves because they feel embarrassed. But it's important to remember, psoriasis is not your fault. It's a medical condition that needs understanding and care. No judgment. Diagnosis is usually based on the appearance of the skin. A dermatologist may take a small sample, a skin biopsy, to rule out other conditions. Blood tests can also help identify autoimmune activity or related arthritis. When it comes to treatment, the goal is to reduce inflammation, slow down cell production, and relieve discomfort. There is no complete cure yet, but with the right care, symptoms can be controlled very well. Topical treatments are often the first step. These include creams, ointments, and shampoos containing ingredients like coal tar, salicylic acid, corticosteroids, and vitamin D analogs. These help soften the scales, reduce redness, and slow skin growth. For more severe cases, doctors may recommend phototherapy, which means controlled exposure to ultraviolet light under medical supervision. Light therapy helps reduce inflammation and normalize cell growth. In cases where topical or light treatment isn't enough, oral or injectable medications may be used. These include drugs that suppress the overactive immune system. However, they should always be taken under medical supervision because they can have side effects. In homeopathic and holistic medicine, psoriasis is seen as a disorder of internal imbalance, often linked with stress, digestive weakness, or suppressed emotions. Homeopathy doesn't just treat the skin, it treats the person as a whole. Remedies like arsenicum, alban, sulfur, graphites, Suriname, Natrum muriaticum, and Calcarea carbonica are often prescribed depending on the individual's mental and physical state. Lifestyle and diet play a major role too. Patients should focus on reducing inflammation naturally. Avoid processed foods, sugary drinks, and fried items. Include anti-inflammatory foods like turmeric, ginger, olive oil, green vegetables, and omega-3 rich fish. Drink plenty of water to keep the skin hydrated from within. Sunlight in moderate amounts can help too, as vitamin D supports healthy skin, but overexposure can worsen symptoms. So it's all about balance. Moisturizing daily is essential. Dry skin worsens psoriasis. Use gentle, fragrance-free moisturizers or natural oils like coconut or olive oil. Stress management is another key factor. Stress is one of the most powerful triggers for psoriasis. Practicing meditation, deep breathing, yoga, or even light exercise can calm your body and mind. Adequate sleep is equally important. Your skin heals and regenerates while you rest. Avoid scratching or picking at the patches, and it only makes things worse and may lead to infection. Keep your nails trimmed and clean. If you have scalp psoriasis, use medicated shampoos and gently massage your scalp without harsh scrubbing. For nail psoriasis, keeping nails short, protecting your hands from harsh detergents, and moisturizing cuticles helps a lot. Some natural remedies also provide relief. Aloe vera gel, turmeric paste, and apple cider vinegar can soothe inflammation when used carefully. But always test a small area first to ensure your skin doesn't react badly. Emotional support is just as important as physical treatment. Psoriasis patients often feel depressed, anxious, or socially isolated. Support groups, counseling, or simply talking to someone who understands can make a big difference. Remember, you're not alone in this. Millions of people live with psoriasis, and many manage it successfully. It's also essential to understand that psoriasis isn't caused by poor hygiene. No matter what anyone says, it's not a contagious condition. Touching, sharing clothes, or sitting beside someone with psoriasis won't spread it. Awareness is key to ending the stigma. Psoriasis may come and go throughout life, but with care, the flare-ups can be minimized, and the skin can stay clearer for long periods. Consistency in treatment and lifestyle changes is what truly makes the difference. If you notice any sudden worsening of symptoms, high fever, or extensive redness, always consult a doctor immediately, because severe forms of psoriasis can be dangerous if untreated. Always take a holistic approach. Medical treatment, mental well-being, and healthy living. Healing starts from within. You deserve to feel confident in your own skin. Psoriasis does not define you. Your strength, patience, and care for yourself do. Be kind to your skin, protect it, nourish it, and accept it. Healing is a journey, not a destination. This is Health Diagnosis, spreading awareness and truth about health and wellness. If you found this video helpful, don't forget to like, share, and subscribe to Health Diagnosis for more valuable information about common diseases and natural healing methods. Stay positive, stay aware, and take care of your skin, because self-care is the first step toward true healing.